So first and foremost, we do at-home STI screening nationwide. This is really, really great because we basically bring testing to you in the comfort and privacy of your homes. So what we were finding when we first started TBD is that there's several different barriers that hold people back from getting tested. So whether that is fear of judgment, fear of going into a doctor and feeling stigmatized, whether it's, as I said, not knowing where to go, or, whether it's work obligations or childcare obligations, there's all these different barriers that hold people back. And so being able to do something at home really lets you sort of do it on your terms and in a way that feels really comfortable to you. So that's what we did. We make it super easy to order online. We have several different panels that you can choose from. And we also have a quiz in case you're not quite sure what panel is right for you.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo. I am your host, and my guest here today is Stephanie Estey, who is the co-founder and co-CEO at TBD Health. Stephanie, thank you so much for being here today.
Thanks for having me. Excited to chat.
Yeah, I'm excited to have this conversation as well. You and TBD Health are the first company that I'm speaking with who is in this specific niche. So why don't you tell everyone a little bit more about yourself, a little bit more about the company and what this specific niche is?
Sure. So TBD Health is a hybrid sexual healthcare company. So we really pride ourselves on non-judgmental sexual healthcare. Both my co-founder and I had awful experiences, whether it was feeling judged or trying to find resources to get tested or simply just not knowing what to do. And so we really built TBD to feel different. Building sort of human and supportive sexual healthcare is something that we have felt incredibly passionate about. And we started TBD a few years ago now and have since served tens of thousands of patients across the U.S. We have actually served people in Alaska, Hawaii, everything in between.
Yeah.
And we're really excited to be making sexual healthcare more accessible.
That's awesome. And one of the things that I said when we were first having our initial conversation, I think is one of the topics that everybody deals with, but not everybody is willing to talk about it. So talk to me a little bit more about how you guys simplify the entire process and just make it seamless for the people who are looking to improve that side of their lives.
Yeah, so we offer services in a few different modes. So first and foremost, we do at-home STI screening nationwide. This is really, really great because we basically bring testing to you in the comfort and privacy of your homes. So what we were finding when we first started TBD is that there's several different barriers that hold people back from getting tested. So whether that is fear of judgment, fear of going into a doctor and feeling stigmatized, whether it's, as I said, not knowing where to go, or, whether it's work obligations or childcare obligations, there's all these different barriers that hold people back. And so being able to do something at home really lets you sort of do it on your terms and in a way that feels really comfortable to you. So that's what we did. We basically we make it super easy to order online. We have several different panels that you can choose from. We also have a quiz in case you're not quite sure what panel is right for you. And you go through our process online. We send a test to your home. You're able to collect your sample from the comfort and privacy of your home. We can do urine tests, swabs, and then also a blood test. So that basically looks like doing a finger prick, very similar to what someone with diabetes would do every single day.
Those are scary. I often donate blood, and I think that's the scariest part is the finger prick.
Yeah, but it's not too bad. I think a lot of people have maybe some apprehension the first time they try it, and then it's kind of
it's nothing. There's nothing. It's interesting. Yeah, it's interesting to me because like this big thick needle to donate blood like goes this way. I'm like, yeah, no, that one's okay. And then like this tiny one that goes on your finger, I'm like, oh, I don't want to do that one. So
well, and that's also why we pride ourselves in showing up on lots of different ways, right? So that's kind of the at-home flow. But for folks who where that would be more anxiety provoking, we also offer access to our clinics, and so that makes it really easy. We have one clinic, one in Vegas, one in Denver, more coming soon. But as I said, it's kind of about showing up wherever the patient's most comfortable.
Yeah, and that's great. That's great. And of course, I jokingly talk about like the pricking the finger. Like it's no big deal. Like it doesn't hurt. It's just like I guess the anticipation of it. But it's interesting. I'm interested to hear if there's a more common pattern or fear or obstacles that patients come to TBD and they're like, oh, this is the thing that really made such a huge difference for me, as opposed to the usual methodologies.
Yeah. So first and foremost is convenience. So that's kind of number one. Whether that is being able to do it at home or just having really accessible appointments. So
Mm-hmm.
most of our clinic appointments are either same day or next day.
Mm.
Um, the other thing that we find is that we are very transparent in our pricing.
Mm.
So if you call an urgent care, for example, they 9 times out of 10 they will not be able to tell you how much an STI test costs. And
Oh, wow.
that can be a really, really scary experience because if you basically are getting tested in these forms, you can end up with a lab bill that's thousands of dollars.
Mm.
And so if you're not sure how much you're paying, that's yeah, lab testing is just one of those things that can get very,
Mm-hmm.
very expensive very quickly.
Mm-hmm. It's a gray
Um,
area for them then.
yeah, exactly, exactly. And so we've tried to be very, very transparent at TBD, you know, exactly what you are paying when you walk in the door and we make it very transparent.
Mm-hmm.
So you know, there's no surprises. You know exactly how
Mm-hmm.
much your what you owe.
Yeah.
So I think those are kind of the two main factors that we
Mm.
really focus on. And then as I mentioned before, it's kind of wrapped in this whole experience of just making the patient also feel more comfortable, right?
Mm-hmm.
So we really pride ourselves on trying to make folks feel proud about getting tested for STIs or taking care of their sexual health versus stigmatized or like they've done something wrong.
Mm-hmm.
Yeah, so that's
And I have a bit of a combination of questions here for you then.
Mhm.
Um, I'd love to understand kind of what that online process really looks like. So from someone finding out about you guys, like how does that usually happen? And then once they go through, sure, they do the testing, everything comes to them. How long does that usually take? And then I think the
Yeah.
part that I'm I guess most curious about here is what then is the report happening online? Do they have to bring it to their doctor? How does that go down?
Yeah, all great questions. So so people tend to find out about us either through a friend or social media or Google.
Mm-hmm.
We got a lot of folks who are basically looking for sexual health or an STD test and they find us. And then once they actually do get a test, we offer pretty quick shipping. So so tests usually arrive within 2 days to your house, and then send it back. That's another 2 days, and then our lab typically takes about 2 to 3 days to process results.
Mm-hmm.
We automatically release results, so you get it super quick. And then if you do need, if you have questions or if you do need antibiotics or a prescription, we hook you up with a telemedicine consult with one of our
Mm,
clinicians.
interesting. So everything's there on the platform. Doesn't don't no need to go anywhere else, wait in lines and all that stuff.
Yeah, exactly. And all of our clinicians go through kind of proprietary TBD training.
Mm,
So we do a lot of training with our clinicians about how do you talk about sex in a non-judgmental way,
hmm.
and how do you you know, even like the language that you use, not
Yeah.
assuming that everyone has one partner or everyone's in a monogamous relationship.
Sure.
Making sure that we always ask pronouns, all of those things to create a very inclusive environment.
Hmm.
Yeah.
Interesting. I wonder how long has the company been around again? Or if you can remind me, please.
Yeah, so we've been around for a few years. We started in 2020 and
Okay, that's what it was.
have been nationwide for I think like 3 years now. So
Awesome. Yeah. So
yeah,
here's what I'm wondering. In that process, I maybe like in the first 1 to 3 years, so like 20 up to like
yep.
2023, was there like a biggest like, oh snap, we really gotta figure our stuff out to either be it with the way you guys do the messaging or the way you do the consults online, just something that happens that you guys like, oh, now this is the part where we really have to get our stuff together, and sort this thing out to really have the impact that we want to have. Is there anything that comes to mind there?
Yeah, I mean, I think that's like every day as a founder, right? You're like always iterating, always trying new things. We do we I mean when we started TBD, we talked to hundreds and hundreds of people about their sexual health experiences and just what they felt was missing. And so we really tried to bring that emotion to life so we could
Mm-hmm.
intimately connect with our
Mm-hmm.
patients. In addition, this was something that both my co-founder and I felt very deeply about, and we ourselves had kind of run into this stigma,
Mm-hmm.
and so we had very personal experiences that we also tried to kind of bring to TV.
Mm-hmm.
But I mean, yeah, we're in a regulated space. We started during COVID, and so navigating
Mm-hmm.
just each state has very different rules when it comes to lab testing, when it comes to telemedicine consult, when it comes to just all those different pieces to create a
Mm-hmm.
really awesome platform that we
Yeah.
had to
Uh-huh.
navigate. And I mean, that's still something that we really pride ourselves on, is like working, like constantly iterating,
Yeah,
constantly,
innovating as well, for
constantly
sure.
experimenting.
Uh-huh.
Um,
Would you say that you view company building in a way that's a little bit different than the usual norm that most entrepreneurs would see it?
how would you characterize most
Yeah,
entrepreneurs, or yeah.
great question, actually. Yeah, great way to define it. So I think so many, and this is just from a pattern that I've noticed from so many, which is now has been like over 250 conversations. Oh wow, maybe I should do something better on my time. I'm kidding. Is I've learned so much, man. It's crazy. But I think it's really just having the notion. Okay, we have something that we want to put out there,
Mhm.
so that it's going to serve some people. Of course, the priority is to serve, but you have to get money to be able to do that in any case. You can't pour from an empty cup, right? So there's this early stages of like really figuring it out, getting the first clients, really understanding that. Then as soon as possible, from what I've spoken with people, is like, okay, let's start delegating. Let's start delegating. Let's start delegating. And then they step away from the process, and the ultimate outcome for either the impact, but as well the growth of the company, never comes to that full fruition, just because there can be some disconnect. Do you find that to be the case for yourself as well? And of course, I'm kind of generalizing here. I know that not everybody does that, but would you say that that's more or less the case for you, or completely not?
Yeah, I think we've really tried to stay close to the process. So obviously our team has grown, but we really try to stay close. And I mean, both my co-founder and I will even like take days and do customer service, for example, and like
Mm-hmm.
just make sure that we are always staying close to patients,
Mm-hmm.
and really close to the patient experience. So yeah, but I also think a lot of founders do that. So I don't know if we're unique in that sense, but yeah, I mean, I think as we continue to build and evolve TBD,
Mm-hmm.
we do try to stay quite close to patients, and
Mm-hmm.
always try to make sure we have really good feedback loops within our organization, just so
Mm-hmm.
um we can just make sure that we're learning and iterating quickly. I will say, as an organization, we're pretty data driven, so
Mm-hmm.
um we put like a very high emphasis on data and learning and insights and
Mm-hmm.
reflection. So
Yeah, I think that's important as well.
yeah.
Yeah, so definitely awesome that you're highlighting that. I think, especially because there is so much data everywhere now that some people just have so much they don't know how to use it. So being able to use things in the right way, I think, is very, very important. And when you're looking at this data, or the what you guys are currently going through to maintain the growth of the company, and of course, I would assume you want to keep the company growing as much as possible. Of course, you mentioned some new clinics opening up. What are some of the challenges that get in the way of that growth, to acquiring more clients, and of course, ultimately having more impact, but also sustainably growing the company at the same time?
Yeah, I mean, I think we spoke a little bit about this kind of before
Mm-hmm.
the podcast, but one of our big, I guess, pivots over the last year or so has been how we've really grown our B2B side.
Mm-hmm.
So TBD started off very direct to patient, and that will always be kind of a big part of TBD.
Mm-hmm.
But about a year ago, we really started to think about, are there different ways that we can partner with other organizations to offer TVD services, but to partner with these other businesses.
Yeah.
So there's a few that are public, but TBD is kind of the engine behind all of Planned Parenthood Direct's at-home STI screening program. That was the partnership that we dreamed of when we started the company, and
Yeah.
that went live in January.
Congratulations, by the way.
Thank you. Thanks. We appreciate it. And then, we're also partnered with companies like WISP, for example, who have over 1 million patients nationwide
Mhm.
in the US. And so it's kind of how can we partner together to
Mhm.
really bring access to sexual health services on
Mhm.
a really wide scale, and kind of use these different channel partnerships
Mhm.
to be win-win for both
Mhm.
parties.
For
Um,
sure. And
yeah.
what about that, like creating, I think with so many, like, again, I just keep recurring,
Yeah.
coming back to patterns because it's like
Mhm.
from having so many of these conversations, I'm like, oh, this person said that. Okay. That person said the same thing. And then that person said the same thing. Trust has often been like a huge part of that conundrum of, hey, we want to build more of these B2B relationships. We want to make sure that they trust us first. There's going to be a long sales cycle behind it. How can we make sure that we speed up the process, convey to them that there is an ROI for them as well? Because at the end of the day, business is business, right? So there's numbers that have to be talked about. So what are like the obstacles that really get in the way of having those conversations, especially when it's something that is dealing with people's health, which is can be a sensitive topic on top of being a sensitive topic, which is sexual health in any case.
Yeah. Yeah, I mean, for us, it's always emphasizing the sort of the trustworthiness that comes with TBD. So we have figured out how to do sexual health
Mhm.
and STI screening really, really well.
Mhm.
So we've spent years kind of perfecting that,
Yeah.
and we have a very close relationship with our lab. We have all of the studies that back up the
Mhm.
reliability of the testing, and all of that is sort of neatly packaged
Mhm.
in a really neat bow. So that really helps with these conversations.
Mhm.
The other thing is that we always just try to get to know folks on a little bit of a personal level as well. So,
Yeah.
for us, we've really made the effort to make sure we go to conferences and make sure we really keep up with different relationships,
Mhm.
and that has been very helpful. And I think just making sure that sales cycles tend to be just faster than
Mhm.
normal.
For
Um,
sure.
so yeah, I would say like the things that tend to kind of get in the way
Mhm.
of those conversations are tend to be if if the organization that we're talking with just has other priorities that they're
Mhm.
working on. So
Mhm.
and with I think with all different types of sales, you have to just make sure to keep them in your CRM, check back in a few months, and then follow back up.
Yes, be valuable, be nurturing of them, of course. Yeah, that I think
Yeah.
it's always a big part of it that gets overlooked. I love the such
Yeah.
a simple code, but like the secrets in the follow up, and it's like making sure that one, you're not just bothering them for the sake of bothering. It was like actually feed them some value as you're doing that in any case. So yeah, that's awesome. And I don't know if I asked you this or if you answered this. Is this your the first company you founded or?
Yeah, so this is the first healthcare company I founded. I have had a little bit of an entrepreneurial bug. So
Yeah.
when I was little, I was selling like vegetables and handmade
Oh.
cards and all of these things and going door to door to my neighbor's
Mhm.
house. My dad and I also started a company while I was in law school at the time, and that was very focused on we sold an argan oil company,
Mm.
so we built that, and then I also worked on a social impact company with another friend who won a grant from Columbia University, and
Mm.
so through kind of all of those endeavors, I really loved the idea of being able to imagine a world and create sort of the create it,
Yeah.
and very very much caught the entrepreneurial bug. So
That's awesome. And here's why I asked that question is because um, I wonder from this current venture that you're in, plus of course all the other experiences that you've had, not to like fully compare it because of course different things are different things, so they'll have different experiences, different challenges, all those different situations, right? So it's always going to be contextual. But when you're looking at TBD Health right now, what's the hardest part of growing the business? And actually, I'll add a little bit to that as well. I asked this to everybody on the podcast.
Yeah.
So, like, if you had a magic wand, they could just wave and solve one problem, one challenge, an obstacle, whatever it might be, so that you can pay your revenue goals or your client acquisition targets, whatever it might be. Like, solve that hardest thing, and just like that, everything else happens. What's that one thing that you'd like to solve?
Yeah. I mean, it's probably the regulatory side of things, right? So it's very difficult building nationwide because there's each state just has all their different rules and regs. So we have to have clinicians, for example, who are licensed in every single state. And so yeah, if all of that were to go away, our lives would be much easier.
So
But
that's something that's out of your control. Is that correct?
yeah,
Okay. Let's look at it.
very much so.
Let me reframe my question. Then maybe that's something that it's in your control. And the reason why I say this is because I actually asked this to someone, and they were like, "I mean, $1 billion in funding would be nice." I was like, "Oh, I understand. That would be nice for me to be
Very true.
like, I'll take it." So maybe something that is in your control that maybe you deal with on a day-to-day basis.
Yeah. I mean, I think right now the other thing that we are really focused on is in particular, like in particular with sexual health, there is so much stigma, and so this is something that we are up against, and we fight every single day with trying to have those conversations and talk about it, and uh, but um, but yeah, sexual health is one of the more tricky conversations that for people to have, and so I think that that just makes things a little bit more difficult.
Getting that first step into the door, is that what you mean by that?
Yeah, but that's also why we're building, right? So
Yeah.
but yeah, in particular, I think sexual health is just one of the it's a tricky thing to talk about. So if more people were comfortable, that would just make it so much easier to have some of these conversations, and something we try to do every day. But yeah.
No, that's awesome because I think it's important to also be able to like kindly educate everybody on the not only the importance of it, but how there's certain things. Like I would assume, and not correct me if I'm wrong here, I would assume that the majority of people don't really know much about like sexual health and what's right, what's wrong, what they need to be doing, what they shouldn't be doing. What's the right methodology to go after a certain situation, like all those things. I think I would assume the majority of people are like completely clueless. They go to the doctor and like, doc, tell me what to do, right? So I think it's so important. Would you agree with that in the first place, or
Yeah, and I think, I mean, this was something that, even I myself I didn't fully know about. So something that I always talk about is, I had no idea that STIs were linked to your fertility, or let alone like the number one cause. So STIs are the number one cause of preventable infertility, particularly for women. And as I said, like I didn't even know that STIs and
I'm just learning that now. So there you go.
yeah, it's and a lot of that is, the sex ed we receive in school, or lack thereof, and or not having conversations with people, or not even feeling comfortable to have conversations with our doctors. But yeah, that makes things a lot more complicated. I will also say, particularly in women's health, reimbursement rates are not are not good. So OB-GYNs are one of the lowest paid specialties.
Yeah, it becomes another obstacle.
Yeah.
Yeah. Well, that's awesome. No, that's not awesome, but it's awesome that you guys are, of course, doing in the journey of educating people, really helping them and like trotting the path, or like opening up the path for them to trot, and making it so much simpler. That's awesome. I have one final question here for you, Steph, which is actually not a question from me. It's a question from our last guest to you, and they had no idea who you were. Here's their question. You ready for it?
Yeah.
If you could go back 10 years and give yourself one piece of advice for your future self, for you now, what would that be?
Yeah, start building companies earlier. 100%. It took, like, personally, it took me a little bit of time to kind of have the confidence to go and build companies. So I did like the very safe safe thing. Out of undergrad, I did consulting. Out of consulting, I went to law school, and then I became a lawyer,
Mhm.
and practiced law for a number of years. So it took me a little bit of time to kind of get the confidence to take the
Mhm.
path less walked.
Mhm.
And now that I'm here, I wish I would have started earlier. So
Mm.
yeah,
It's the lessons that we hear all the time. It's like, do it, do it, do it. You're like, yeah, I understand it, but actually going through it, it's the unteachable lessons. You have to go through it, and then once you go through, you're like, oh, I should have done it, but nothing to change about the past. Now I just focus on the future. That's awesome, Steph.
absolutely.
Yeah, thank you so much. This has been such an incredible, insightful conversation, and I can definitely say I've learned something new today. And it's funny because I actually, not that it's related to anything with sexual health and such, but I actually have a bachelor's in kinesiology, which is of course related to health. So even me, who is like I would say more knowledgeable than the average person when it comes to biology health, did not know that. So I can only assume people that know less will know less. Anyways, here it is.
There you go. Spread the word. So
Exactly. Yeah. Thank you so much. This has been awesome. As I said, where should people go if they want to learn a little bit more about yourself or a little bit more about TBD?
yeah, you can check out our website. So www.tbd.health. And yeah, we have a free prep program that we launched in January, which makes prep very, very easy. And that's our fastest growing service line right now. So yeah.
Amazing. I will, of course, leave everything here down below if you want to check that out. And if you enjoyed listening to this conversation and you want to hear more conversations like this, please subscribe and I will see you on the next episode. Thank you so much, Steph.
Thank you.